start recording and then drop this information in the chat for everybody as well. All right, so Megan, if you want to start this.
Absolutely, Caitlin. Thank you. Switching screens really quickly. Can you all hear me okay? All right, welcome everyone to our Behavioral Health Administration Advisory Council meeting on this beautiful March 20th day. Thank you for joining us. We are glad to have you here, and I will go over a few things within the packet: closed captioning, group agreements, codes of conduct, and all of the information is linked in the document that Caitlin shared in the chat. For ASL interpretation, I can see our interpreter pinned on Caitlin's screen. Caitlin, thank you for doing that. You may also adjust the ratio of the screen being shared by hovering your mouse to the left of the panelist until your mouse changes to a horizontal arrow. Left click and drag your mouse across the screen until you have reached your desired view. For closed captioning, you can click on the button at the bottom of your Zoom window to turn on subtitles. If you need to change the subtitle language, click the caret to the right of the button and select your desired subtitled language. Remember, if you need assistance, please send a message in the Zoom Q&A. Members of the public will have a chance to speak at the end of the meeting. If you're unable to answer, if we're unable to answer your question, we will, there's a link that you can click on for additional, to provide additional feedback, and we will get back to you. There's also, the meeting is recorded. It will be available on our BHAAC website. And then a few reminders for council code of conduct, to be respectful, regular attendance, consistent attendance is required, to always be prepared for the meetings, to engage as a council member, and to always be professional at all times. And then there are additional resources available at the bottom for your review. And with that, I will pass it over to our chairs.
Good morning, Council. Good morning, everyone. It is always good to be in your presence, every single one of you today. Welcome, welcome. Let's go ahead and call this meeting to order. Vice Chair Tasha, will you roll call, please?
Yes. Do we have to motion for the meeting to order? Okay. All right. Just making sure. All right. Good morning, guys. Good morning. Karen Renee Anderson.
I am here.
Danielle Ngotti.
Present.
Dr. Rob Archuleta. Preston Berry. Whitney Butcher.
Present.
Ash Castro. Raquel Garcia.
Present.
Carolyn Hall.
Present.
Asha Conker, present. Judge Elizabeth Leith. Maria Martinez. Keith Parker.
Here.
Antonio Pito.
Got it correct. Here.
Good. Thank you. Nor Shafee. Jamie Ulrich.
Hello. Good morning. I'm here.
Good morning. Cameron Vigil.
Present.
Catherine Washington.
Good morning, present.
Morning. Seth Watkins. So I always have a problem with this one. Selwyn White Skunk. And that concludes our roll call.
Thanks so much, Tasha. Do we have quorum?
We do have quorum.
Okay, thank you so much. I appreciate that. We'll just do a review of the event agenda. We'll start with a review, and then we'll go into the approval of our meeting minutes. And then we'll have a council debrief and on the child and youth implementation plan. We will do administrative review with Megan Shelton. Will do a review of the CCBHC review with Megan Shelton. We'll talk about membership and recruitment updates, making sure that we have all of our council member reapplication status. We'll get a update on that. We'll have a break for about 5 minutes. We'll come back and do a performance hub review with the BHA, and then we'll be open up for public comment. I need a motion on the floor to approve the February meeting minutes.
I make a motion that we approve the February minutes.
I need a second.
Second the motion.
Thank you, Catherine. Thank you, Maria. So moved. The February meeting minutes are approved as is. We will go ahead and archive those. Thank you. And now we will have a council review of the child, youth, and implementation plan.
You gotta make a motion for the February minute.
Oh, yeah. Well, we made a motion for the February minutes. Second. Oh, we didn't move to approve. Sorry, that's right. My bad. You're right. I need to move to approve the minutes. Anyone oppose?
I motion to approve.
All right. Yeah,
Tasha Conker.
my bad.
Oh, great. And then is there a second?
Since there are no oppositions to the minutes, they are approved as is. Move forward. And now we will have our council debrief on the child and youth and implementation plan presentation. I'm gonna pull that up.
I'm also going to drop the link for this in the chat for everybody to review on their own as well.
Does anyone have any feedback, discussion, conversation around the child, youth, and implementation plan? Jamie?
Hello. I think just in general for not just the child and youth implementation plan, but all areas around behavioral health as it relates to children and youth. So the settlement agreement that is currently being worked on at HICPUF, I really just want to make sure that we are really clear on some of the roles of the care coordination aspects, and really hope that we can dig into those points of care coordination throughout a person's experience with behavioral health, no matter what department they're going through, to get services, just because it does seem like there's a lot of different care coordinators out there, and really just want to make sure that we're using resources appropriately and that people know at which points they're going to be engaging with a care coordinator. So that's not necessarily something I think should be answered like this morning. But I just want to put it on BHA's radar that I would love to have a deeper discussion on all of the areas of care coordination.
Yeah, I hear a little bit of that, like deeper dive and also some clarity as to what that looks like, right? And what is the process for that care coordination? Because that's the conduit of care across the behavioral health sector, right, Jamie? Am I clear on
Yeah.
that? Okay,
Yep,
good.
that's
So
exactly right. Thank
bring
you.
that forward. Great. Thank you so much. I appreciate that, Jamie. Tasha.
I just bring up with child youth involvement with the jail-based services. Um, I'm wondering if we could get a little bit more clarification with that. Is that where it's going to start with our mental health services too? Is through the jail base? I'm not too sure. I just need a little bit more clarification on how that's going to be implemented um, with our children and youth, because I asked about that last meeting about the jail-based services when it came to child, youth, and services.
Right. So the difference between, additional traditional, I guess is a word for behavioral health service, and the difference in how that's going to impact jail-based services,
Yes.
BHAAC, and other youth-based services that belong to the judicial system, right?
Yeah.
Okay.
Thank you.
I love all these points bringing forward. I know one of them for me is also a focus on our very, very limited resources for Medicaid and for youth and SUD services. For youth, we have very little that are Medicaid. Actually, I don't think we have one or maybe one in the state. And that's a huge issue considering how many folks and families and youth depend upon Medicaid for their behavioral health services. So that's what I want to bring to the forefront.
I know these questions have been coming up quite a bit. Is this something that you all would like us to try to find time for presenters to add an additional discussion? Likely, I'm thinking collaborative presentation actually with our criminal justice team and our kids team to be able to dive a little bit deeper.
Yeah, it sounds like a little back and forth discussion, Megan. I agree.
Okay.
Because I think we can understand the high level and what we want to achieve, but then we want to know like the underneath and how it affects different communities within youth, right? Different populations of youth across the state. Because you're talking about something very different from the Denver metro area to, those I serve in Alamosa. Very different, very different. And then when you add a layer of Medicaid to that, even less. Anyone else have any discussion we want to bring forward to the BHA for clarity?
There is something in the Q&A about bilingual care coordinators. If we could get an answer on that, that'd be amazing. Thank you.
Absolutely, absolutely. That would give us culturally responsive care. Absolutely. It empowers communities to make their own decisions when they're informed in languages they understand. My mom being from the south of France, I understand how sometimes that can be a challenge. Carolyn.
I have a question, because I'm always concerned about people that are not Medicaid eligible. And so I just want to know if people, because I do this a lot, helping people to get on CICP plus, especially for the kiddos, so that they can receive their mental health and their physical care. While they're waiting on Medicaid or until they're able to get an insurance. It does carry for 6 months, and every 6 months you renew. So I was wondering, how does that tie in here?
Great questions, Council. Great questions. And I love that it's being recorded because they'll grab all those. And that's what Caitlin's the master of, and grabbing all that so that we can make sure that that's part of the discussions. We'll meet with Megan so that we can get the answers to those. Yeah,
Thank you.
absolutely, Carolyn. Megan?
I was just saying, I love the discussion. I love the hard questions that you're giving to us. This is what we need. This is really helpful to be able to bring this forward. Even if we don't have the answers for you today, we can work on getting all of that for a future presentation.
Absolutely. Jamie?
Since we're looking at the CYMHTA funding slide, I know that there was a budget request to reduce the funding for CYMHTA for next fiscal year because of underutilization. And I just wonder if we could talk about what that underutilization, the reasons behind that, because I do think it's a really good program. And I wonder if it's just because families and parents didn't know about it or the community didn't know about it. And by cutting the funding, it then provides less opportunity for people to access it. So would we have the ability to, I mean, I guess we always have the ability to go and ask for increased funding later, but just would love to know more about why this program has been underutilized.
Yeah, and what were the community efforts that were put forth to engage community so that they knew, right? Like, how was that message also sent out to community? If it was underutilized, did we do a good job of informing communities? Jamie, right? Yeah, I see that. Thank you so much for that.
Yeah, you nailed it. Thanks.
Yep, got you. Tasha.
I'm curious to know that DYS, they added more beds, and I'm wondering why. And also for CYMHTA, why will they not serve Medicaid kids? And underused because they don't serve, and the underused, with concerning the underused, because they don't serve Medicaid kids. Am I making myself clear there?
Yep.
Okay, thank you.
Question about Medicaid crossover or lack of crossover into the CYMHT or CYMHTA.
Yes.
I will reach out to Lindsay Edwards for specifics on this, but my understanding was that this was supposed to be originally supplemental. So for people that didn't qualify for Medicaid, so they weren't able to get the services through Medicaid, they would be able to get the services this way. I don't know the exact reasoning though, and I may be missing something there. So I'll follow up with Lindsay on the history of that.
Thank you, Megan.
In the interest of time on the agenda, we still have some more time if there's any further discussion. Jamie.
I guess I'm just wondering how the follow-up is going to happen with these questions in this discussion. Is there going to be a separate meeting, or are you going to capture these and do a Q&A document? How are we going to be communicated with regarding some of the things we brought up today?
Answer that. So Jamie, if you look at the meeting minutes, you'll see the discussion section in there, and I have hyperlinked notes that I'm taking. And so everything that you all are saying, I'm writing down, and what I do is I ping or like I message the presenter from the previous month. So for this month, I'll be tagging in Lindsay Edwards and who was it? Kelly and Mark, so they can kind of see your notes and comments and respond to it that way in these Google Docs. And then we do have some recap sessions planned on later in the year for members to come back, for those presenters to come back and speak to us to kind of address some of these topics and questions as well.
Great, Tasha.
Can we ask that Lindsay Edwards come to this follow-up meeting for these for this stuff. And also there are concerns around out-of-state placement and facility safety. I think that's a major concern.
Duly noted, Tasha. Thank you. Any other discussion on the floor? All right. You can move a little head up our agenda. One in the chat. Hello, seeking clarification in general. Is the BHA main focus on children, youth receiving behavioral health care services?
Oh, sorry, Raquel, I answered that. I typed it. I said that our primary focus is not necessarily children and youth. That was our presentation last month.
Right.
That's what we're debriefing today. That's part of our aspects, but not our primary focus.
Right, exactly. Yeah, we just had a presentation last session on that. And so one of the things we've done to shift the way this council runs is a lot of things were spoken at us. We don't get a chance to publicly have discussion. And I really am enjoying the fact that we get presented something, we get some time to think about it, bring those things to discussion. So I'm thoroughly enjoying the fact that we get to run council this new way. Everyone else liking it? Yeah, we get to bring our questions to the public. Great, 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 great.
Rochelle, excuse
Yeah,
me. I have a
absolutely.
question. It was mentioned earlier about is this youth program was not, it was underutilized, and then I heard it was not possibly, maybe not, you know, put out in the community enough, or maybe need some addition, you know, whatever that, you know, may look like. So my question is, how would somebody in the community know about this program? How would they utilize this program? Have anybody from outreach or anybody or anything like that have any kind of feedback, any kind of recording, any kind of records of how it went into the BIPOC communities, or, you know, what did that look like?
Yep, that was the question already posed. So we have that in record that we'll be asking for that, right? We want to know, how was that given out to community? Who was involved in that? What did that look like? Those are the things that Jamie had brought forward. So we will ask those questions and make sure that we get some answers as to, because we don't know if it was underutilized. Why was it underutilized? That was what Jamie asked. What did that look like? So just to say underutilization, we want to know more. So we'll make sure to get those answers, Keith. Thanks for.
Right, because last thing, I would like to know the people who are responsible for that. That's my main concern. Who are the people uh tasked with getting that out to these communities?
Noted. Thanks so much, Mr. Parker. Tasha?
I just want to make a comment. I wish they would bring all of our committees together um, with like all the stuff that's going on, so we could get a whole entire debrief all the way down from CYMHTA to everything else that we do. You know what I'm saying? Like bringing them together so we're all a collective. Am I making sense? Okay, thank you.
All the councils. Yep, I hear you. That'd be a busy meeting. But yeah, maybe quarterly or something like that, just to touch base. Megan?
Yeah, I was just going to respond to Keith a little bit on the budget for CYMHTA. I know that over the years, that budget it was continuously expanded. And so there was a high need for the program, and we continue to expand the budget based on that need. And then I think we got to a point where we finally found kind of the mark of where it was utilized and the right budget for it, but had maybe overexpanded a little bit more than it was utilized. And so I think that's where it made sense to adjust the budget back, because it no longer needed to be, we kind of overshot with how high it was. But really wanted to be clear that this budget expanded progressively over time because there was such a high need for this program.
Thanks for that, Megan. Appreciate it. We got about 8 minutes left in discussion of this subject. Anyone else have anything else before I move forward? Tasha, is that a new hand? Sorry,
Yeah, I was just gonna say I put it in chat or a liaison for that. Thank you.
It looks like there was a message in the chat about our
I see
community
it.
engagement specialist.
Yep,
Megan,
they are
you
out
wanna-
and about. Yeah, absolutely. Those 4 regional community engagement specialists are new, right? So that might be something like we could ask them to speak about that. That was a great suggestion, Kate. Appreciate it. But yeah, they're out. They are out and moving. I have met several of them in the region. So you actually can meet with those community engagement specialists. Megan has been working hard to get them out in community and doing a great job, to be honest, for the amount that they've taken on. Megan, and then Jamie.
Yeah, I was just going to add, Kate, they have been really working to expand their networks and get to know folks all throughout their regions. They have developed frameworks for how they are engaging with underserved communities throughout their region. And I think they're starting to really make a presence. I get really excited when folks reach out to me and say, "Oh, I met Calandra out in the community," or "I talked with Brittany about this." They're starting to really make those connections. It just takes time, and that is something that our council can be really helpful with as well. Is really reaching out to having our regional engagement specialists connect with council members. And I know some of you have, and I've appreciated that so much. Those connections that you've made to really link them into your communities and help them expand their networks.
I think it may be beneficial for council to receive, and I don't know, it could be lost in my notes, a list of those specialists, just in how they are and what regions they serve. I don't know if everybody else on council, if that would be helpful for you or if you have access to that, but just top of mind while it's here. Jamie?
Thank you. I also wonder so I think at the beginning of the slide deck, it talked about kind of year one items that were completed. You know, you have the green dots, like these are all the things that we've completed in year one. And I have not reviewed this slide deck, so full disclosure there. So apologies, but I've seen a lot of this information in many different areas. I wonder where we're at with year two planning. I believe we're like smack in the middle of year two, if I'm not mistaken. If we could just get an update, you know, it's good to see what we've done in year one, but how are we prepping and what does year two look like?
That's great. So a current update to see where we are, especially as we're in March or whatever, to see where we're at. Because then we also need to know where we're going, right? Because it's great to see where we've been, but where are we and then where do we have to get to? That's the coach in me that shows up there. Tasha.
Concerning one of our the Western region, Rachel Simpson, do we know who's going to be? I didn't want to say. And will that? And then also, thank you, Kate. When will that position be filled, if so?
Tasha, I missed the first part of your question, and then I'll answer the rest of it. It just glitched for a second. It might have been my
what
end.
it was. Rachel Simpson, the Western specialist, correct? She was fired. So I'm wondering who's going to be replacing her.
So Tasha, we are not able to comment, confirm or deny any personnel issues. So I can't comment on that. But that I can assure you that we will be posting that position and filling it as quickly as we can.
Okay, thank you for the clarification and transparency. I appreciate it. And so does the public.
All right, any further discussion? 3 minutes left for this before we move forward. All right. All right, let's move forward. We're going to do, Megan's going to give us a review of the CCBHC. We're going to receive an update today. Megan, it is you on the floor.
I believe this was a topic that we discussed during our last meeting, and Ryan Templeton came and gave you all some additional information. What I can share with you is BHA is working hard on all things CCBHC, and currently working on forming a team to begin writing the rules, and then we will have community engagement sessions to educate, to find out information, listening sessions, as soon as that is complete. And so this is we are working very quickly on this. That team's going to start working beginning next week on that work so that we can start to move forward as quickly as possible. And we will continue to have updates on that. And so at follow-up meetings, I don't have any additional updates from what was shared last time, but we will continue to have those as that work starts to move forward.
Yeah, and just wanted to let the council members know that I've actually been tasked with helping with writing the rules for CCBHC and our ACM4. So I am actually going to be taking a step back from my position as the BHA boards and commissions for right now. And Megan and her team are really going to be, increasing their presence in these meetings and helping support the council moving forward as I am temporarily reassigned to those roles. So I just wanted to let you all know, if you don't see me visibly as much or you don't hear from me as much, I'm not abandoning you or leaving you or anything like that. I'm here for you guys. I want you to know that you can reach out at any point in time. You have my cell phone number, you have my email. Feel free to reach out if you have any comments, questions, concerns, you need anything. I'm here for you all as normal. So just wanted to let you know if you don't see me as much, that's why, but don't feel like I'm abandoning you or anything like that, because that's not the case. I'm definitely still here for you. And then, like I said, Megan and her team are going to be kind of taking this lead moving forward, and they are wonderful. We'll be here to support you as well. Same, with the BHA as well. So definitely don't worry about that, but just wanted to kind of inform you what's going on there.
Thanks, Caitlin, and thanks for all your support in getting this far. I don't feel like we'd be as confident in handling this had you not helped us at the very beginning. But I think, you got a good chair, good co-chair, and with Megan's support, we'll be good. But thanks for all you've done to bring us this far. I wouldn't be as confident, I can tell you that, without you. The first 2 years were bumpy. It's been so nice to have you. You brought a nice rhythm to us. I appreciate it.
I appreciate that. I really do.
Yeah, of course you're being called to help out somewhere else. That's just natural. They're smart. They're smart. BHA
I
smart.
think just like the OCD color coordination that I do. So
It's beautiful. Your brain is beautiful. Beautiful
thank you.
brain. Thank you so much for the update. Thanks for the update from you, Caitlin. We wanted to move forward and talk about our membership and recruitment. I know I've sent out several. We've got some emails to expand our council. And then Caitlin's going to give us an update on the council member reapplication status. I think we have all but one, I think I read, has submitted a reapplication.
So
That we know of, that's coming, that plans on it anyway, right? We aren't sure. We have to say goodbye to Miss Ulrich, which is really sad, Jamie. But she's got some big stuff that she's doing. And so, Jamie, thank you so much for all your time supporting the council and your questions. I hope you pop in here from time to time to ask those tough questions. You don't have to be a council member to be here, that you come in and continue to push us to excellence for the state. So I appreciate you. And if we can ever support you in the work that you do out in the field, let me know.
Thank you so much for that, Raquel. And I just think you and Tasha are doing such an amazing job. And I have just really come to love this group so much. I just really appreciate the engagement and the just real talk and honest, here's where we're at and here's what you need to be looking at. BHA, which is so important for us to have those conversations. I'm really going to miss this group. I will pop in, but thank you so much for having me. And I just really appreciate you all.
Thank you, Jamie. It was a pleasure. It was an honor working with you and collaborating with you. And I hope to be able that our paths cross and we can all still collaborate together. So thank you.
Jamie, you've been such value to have on this council. And I know that many of us will continue to work with you in other capacities. So I personally am grateful for that. And just really appreciate everything you've done. I can't believe that it's already almost been 3 years of our council.
I know, it's 3, that's crazy, 3 years. So as all of our council members know that have been on our inaugural council, we've sent out a couple of emails to you all reminding you to reapply for that second term. So far, there is only one council member that I have not spoken with that has not reapplied. I emailed them this morning. So if you think that might be you, if you could check your email and just respond to me, letting me know your plans either way, whether you want to reapply and just didn't get the time to do it yet, or if you're not seeking that second term, just so we know for our recruitment season, which we are actively involved in right now. So we are accepting applications for this council until the end of April. We have sent emails for the council members to disperse to their networks for just, recruiting and kind of spreading the word. Right now we have 14 applications, which is great because we just went live about 20 days ago. So we're almost getting an application a day, which is wonderful, but would love to just kind of keep increasing that, keep increasing, this is belonging on this council, really getting out into communities that we haven't contacted before, haven't had representation before. We are doing social media campaigns right now. So if you don't follow us on social media, I highly suggest as a council member, you do so you can start sharing those social media posts with your networks as well. We also are trying to tap into various newsletters and different news articles. I know that you all have provided information before that we're tapping into, but if you think of anybody else or any other organization that you would like us to reach out to and tap into, definitely let us know, or feel free just to, share our social media posts or those recruiting emails as well. So I see some questions in the chat from Dr. Rob. How many members will there be? So we would like to get to our full capacity, which I believe is 19 members. It is in our bylaws for statute. So I need to just jump that on and make sure, but we want to get to full capacity this next upcoming fiscal year as well. So so we'll be definitely still recruiting. We're still trying to figure out exactly which seats we need due to our first term ending. So we'll have more information to come exactly, who those seats are for our executive subcommittee to be able to kind of go through and recruit there. So any other questions about that right now?
Got some conversation happening in the Q&A.
Yes, I'm typing out one.
Okay.
So recruiting a deputy commissioner in charge of adult services. Commissioner Smith is the commissioner for all of BHA. So she does oversee both children and youth and adult services that are provided through the BHA.
I was just going to add to that too. I know we are very close to hiring a deputy commissioner that oversees the adult continuum of care. So hopefully within the next month or two, we should be able to make an announcement if all goes well.
Tanya, I see your question in the chat about which seats are available. Megan, do we have, I mean, not Megan, Caitlin, do we have specific seats available as far as like lived experience or that, or is it open right now
So we
for
have,
application?
yeah, we have several open positions. So we on the application, when you apply, you'll see kind of like what you represent the best out of the different choices that we have available. So that information is on the application if you go to our BHAAC website. And I will drop the link to the application in the chat for everybody.
You're welcome, Tanya. And if you got any questions, Tanya, you can always text message me. Tasha?
I was just gonna say, on Tanya's thing, like, how does the public know?
It's on the application.
It's
Okay.
on the application.
Okay, thank you for that clarification.
Yes, Dr. Rob, welcome, welcome.
Hello, all. Sorry I snuck in. I'm here doing a presentation at somewhere that has like a lot of security. So I snuck in, they got me into a room. I just would love to know, as the weather gets better, if we'll have more opportunities to meet in person, especially with new members coming on. I just think it's so helpful that if we're face to face and in person, I just think it creates more connection, in my opinion.
Thank you so much, Rob. Yeah, we have talked about that and maybe doing some hybrid meetings where we can, those that can attend can come in hybrid. I remember at the beginning of council, actually at the very, very beginning, it's actually the first time I ever met Tasha. I had hosted at one of our locations in Castle Rock because it's right on I-25, and I had met Tasha and a couple council members there. So definitely something I think is important too. We could host it in different areas for those who can attend, be really creative with that. And then have those community engagement specialists show up in that, maybe according to those areas, Megan. I just saw your nod, right? And then we can try to have a co-meeting right there. Yeah. I think it's great. Thanks, Doctor.
Absolutely. Would love that opportunity for the community engagement specialists to show up. Whether or not they are even from that community, I think they all really want to be involved with the council and are often on these meetings. I know we've got at least one of them. I think she's not a panelist right now, but she's on the meeting, involved, listening to your input, and then we have discussions in our team meetings about how they can incorporate what they hear and what they learn from community.
I look forward to going in relationship with them. I was like not overwhelming them, get their feet wet, meet with a couple, but then, yeah, I mean, and that's what we want to be utilized for, right? That's what we get to do, is that we get to be that cross network between the community engagement and those of us who are, every day doing services. What's up, Rob?
Yeah, I was say, I think it's extremely helpful that the BHA has those positions now, because you're not going to get to every community, especially the rural communities, and somebody needs to be reporting back to what's going on, what the needs are, how things are unfolding, and with the BHA and the new BOSO system and budget cuts and anxiety. Like, I know that we've met with Mari a few times, and it's cool to have the BHA walking in, some representative from the BHA walking in your units. Do you know what I mean? Seeing what you do, especially for agencies like ours that are in 22 different counties, and with the exception of, Ryan coming for mat services, like, it's very rare that we get visits from the BHA, and we definitely love having them there so they could see exactly what we're doing.
Agreed. And it's also been nice too, as you know, our council grew and who people now who know who we are and what we do and how access is nice for us not also to carry that burden alone. And I have somebody like Mari also who is very engaged in our region. I will say that like my favorite thing about them is they went to the most rural part first and worked their way backwards to the most populated. And so that I know for instance, for a fact that that's how they're engaging in community is not starting with the greatest population is working their way backwards. And we're really blessed, I think, Rob, to have them in our region because Mari's very engaged, very interested, very wants to know. So I feel like we definitely are blessed in our region to have that engagement specialist.
Thank you all for this fabulous feedback. This team has been really exciting, really new. We've had a lot of lessons learned as we've continued to build it out and ensure that connection within community. So we will continue to grow it and expand it. And I think you all, as you all are aware, BHA has really increased our presence out in the community with the community conversations that we had last fall. We are expanding on that for 2025, going to 4 additional sites this year. Commissioner Smith is very committed to being in the community, not just with a presence, not just to show up, but if you have attended any of those engagement sessions with Commissioner, it is a conversation. And it is meaningful and intentional. It's with purpose to hear from community so that we can use that feedback to continue towards system reform and continuing to make things better and meet the needs of Colorado's people. And so the engagement specialists, as well as myself and our regional engagement manager, have attended all of those events and will continue to do so to continue to make those connections with community. And then the regional engagement specialist will continue to follow up with those community members.
Thank you so much. Anything further? Anything on the application and reapplication process? If you do know of someone and you missed the email, you can get into my inbox or Tasha's inbox or Caitlin or Megan's inbox, and we can give you an email that can be sent out. I know I've sent it to several people asking if they'd be interested in joining us. Specifically, rural and BIPOC communities was one of my focuses. Emphasis on the rural and frontier spot for me because it's very different, and they often don't get a voice up here. So I really want to make sure that we're listening to them. Yeah, I agree, Rob. It was great to have the commissioner in Pueblo.
And I do believe she's coming back to Pueblo. Correct me if I'm wrong, Megan. And I also just wanted to let everybody on the council know with regard to those in-person or hybrid meetings, we're definitely trying to do that. We put forth a compensation proposal to at least help with possible reimbursement for those hybrid meetings, at least, for like mileage and things like that. We've presented that to the commissioner, and we're, just because of our $1 billion budget cut this year, we're waiting for the figure setting and long bill to come out to confirm budget and things like that. So we will have more update for that in a little bit, but that's just something that we wanted to let you all know and kind of keep on the forefront of your all's minds as well with regard to those hybrid meetings. But it would be something that we're really interested in doing and want to do because I just love to see everybody in person. And like you said, Dr. Rob, I think that it just kind of builds that level of camaraderie. So just wanted to throw that out there as well.
And I did want to confirm that, yes, Commissioner will be returning to Pueblo. And we have not locked in all of the dates, and the locations are subject to change just based on different circumstances and need. But currently, we are planning for the community conversations for 2025 to occur in Alamosa, Mancos, Boulder, Grand Junction, Lyman, Fort Collins, Breckenridge, Pueblo, Denver, Sterling, and we will have a statewide virtual engagement session as well. So it will be a very, very busy spring, summer, and fall getting out into the communities. And as soon as those schedules are finalized and confirmed, those will be available. We will share them everywhere and ask you all to help us spread the word as well.
Yeah, if you didn't get to one last time, I would highly suggest as a council member, if you're able to and have the capacities to attend, if it's in person or virtual. You learn a lot, really, even if you can cross over to different communities and listen to communities outside of yourself too, right? Because part of what we're doing is, yes, bringing our communities to the forefront, right? Where we work and where we serve, but also, and where we live, but also thinking of that as a global, as a Colorado, right? As a whole state, also. So it's kind of a cool way to listen to what's happening in other regions also.
This
Tasha?
is this is Renee.
Oh, sorry, Karen. Go
Sorry.
ahead, Karen.
I'm sorry. I couldn't find my
It's okay. Come
my
on, Karen.
hand to raise. My question is, I think it's great that all those areas are going to be covered, but we're still missing a huge area where I happen to live in the southeast corner of the state. And there's major, major problems with so many facilities closing that we really need the commissioner to come down here, see what's going on, and talk with the people down here. Pueblo's great. It's an hour away from where I live, but there's a lot more east of me that I think would be really good to have the commissioner really meet with the people down here. I mean, there's facilities are closing because they just don't have the support. So I would just highly recommend that that gets added as well. Even when you go to Pueblo, it's an hour away. You can come over here to La Junta, you can go to Lamar, any of those areas we can really use some input. That's what I wanted to say.
No, thank you so much, Karen Renee. And I also think that too of like I just met Springfield's mayor in Baca County.
Yeah.
You know, those corners spaces. Yeah, thank you for bringing that up.
Yep, sure.
Thank you. And our goal is to get out into all of those rural communities and continue to expand. So as you'll see in 2025, you'll see all of the sessions, or in 2024, I'm sorry, you'll see all of the sessions that we did. And then we've added 4 additional ones. And one of those is Lyman. And one of those is Alamosa. And so continuing to expand in more rural areas, and we will continue to do that. I would love if we could be everywhere all at once. But as we look at then further out what these look like and where we get, we will continue to go to new places. Intentionally for 2025, Commissioner communicated during all of the community conversations that she wanted to return to those communities for the next round. So that's why we're repeating and going back to everywhere we were in 2024 to really have follow through on those communities and then adding additional ones. And so we will continue to build out our engagement plan in further years so that it may not mean that we can go everywhere every year, but being able to really focus on adding additional locations and really getting into those rural communities, just like you're talking, Renee. We really have that commitment to ensuring that we're expanding all throughout Colorado, our engagement.
Well, and I remember when the commissioner was in Pueblo, she said, you know, let me come back and give me a report card on how we're doing. And so I think what I love about that is that she doesn't just want to hop around, that she wants to circle back. She wants the feedback. She wants to know, did we hit the mark? What are we still missing, right? So I think it's one thing to watch people go bounce around, but if we don't circle back for, you know, an inventory, right? And I'm in recovery, so we call it like personal inventory. We don't check a personal inventory to see how we're doing. Then what's the point in continuing forward too, right? So I love that she's going to do that. Tasha, and then we'll move forward. We'll get a little break.
I was just gonna say time check. And also I'm gonna just put an input. I would love to see the commissioner in the rural areas because that's where we're lacking in. Instead of the major, it needs to be the rural areas so we can get ourselves out there in the communities because that's a hard one. So yeah.
Thanks so much.
Commissioner agrees with you, Tasha, and that's why you'll see all of the locations. Majority of them are rural areas.
Yep. Yep. I actually know that commissioner plans on doing that. I'll get to join them at a couple of those out in Grand Junction. All right, y'all, we've got about 5 minutes. We'll run 1 minute over, but we'll run through. I think we don't have a lot more on our plate. 5 minutes. Alexa just told me it is time.
I'm not quite sure how to help you with that.
Now it tries to talk to me because I just said its name again. Hope y'all had a quick, nice little break, nice stretch, got up and moved your bodies. We'll move right in just due to time on the Performance Hub review.
Awesome. I'm happy to take it away. I see someone is sharing their screen. I'm happy to share my screen if that makes it a little bit easier. Before I get started, I wanted to say thank you so much for welcoming us back. Here I see some familiar faces. It's great to see you all. I will try to be brief with our updates so that we can get into some Q&A. And thank you for making me a co-host. I will...
Let me know if you still can't share via, because our Zoom's been having some difficulties this morning, as you might see with our ASL interpretation. So
Got it. All right, I'm happy to let you know when I need to go to the next slide.
sounds good.
All right, next slide, please. Let's jump in. So we have an agenda here. Would love to just recap for anyone who's new what Performance Hub is, what we set out to do, and then tell you what we actually were able to do. So what we've been up to since the last time.
Am I the only one that cannot see slides? Just asking.
I can see slides.
Okay, go ahead. Then it's me. That's why I was asking. Go ahead.
Okay. Great. So we'll talk a little bit about what we've been up to, and then I want to spend some time addressing some of the great recommendations you all prepared as part of the 2024 report, and tell you areas that we were able to achieve from our perspective and areas that we're still working on. Let you know what is actively upcoming, and then make a small request for support, and then jump into questions. All right, let's get started. Next slide, please. So to briefly overview, to briefly provide an overview, this is Performance Hub. So Performance Hub is a website which takes in a number of data sources from our BHA data lakehouse. It hosts data visualizations and contextual information about the state of behavioral health in the state of Colorado. It should be seen as a key data source for behavioral health by both providers and the general public. It is an iterative resource that we're hoping to expand on in years to come. So it exists in the state that it exists in right now, but we're excited to expand on it. Before I show you a little bit about what that looks like, want to, next slide, please. Want to talk a little bit about what you saw when we last spoke. So when we last spoke, this was, I believe, right before go live in June 2024 or May 2024. So this was right before we launched. We did research, metric design, strategy sessions with folks on this call, a working group with members of this council. And we were able to successfully launch Performance Hub, and we're really excited about that on July 1st, 2024. But the work didn't stop there. Next slide, please. After we were able to launch Performance Hub on July 1st, 2024, the Performance Hub team has continued to do research and design new metrics for publication in alignment with BHA's overall strategy. So to date, a total of 8 key metrics have been published since July 1st, 2024. And we are actively going through comprehensive and collaborative analysis and review to add additional metrics, which I'll talk about shortly. Metrics are accessible across the board with geographic, demographic, and temporal or time-based segmentation, which essentially means we're able to look using filters at some of this data through the lens of demographic, geographic type data. Next slide, please. If you haven't yet dove into Performance Hub, I highly encourage that you click the link that Lauren, my colleague, just dropped into the chat. This is Performance Hub. This is what the front page looks like. If you click into these boxes on the right-hand side, they're dark blue boxes, they will take you to subpages which have visualizations that are interactive. Next slide, please. All right, next slide, please.
Sorry, I was on mute. I was talking to you there. I said we do have a question in the chat. Do you want to wait until the end or answer those as we go?
I'd love to answer questions as we go along.
Sure. So Tasha asked, how is this data being collected and who is reporting the data?
This is a great question and a great segue to my next slide. So why don't we go into the next slide? To answer your question at a high level, we're really looking at data that is collected by the BHA. There are several data sources and more details on the website for each metric, but I'm happy to take two examples here just to give you a sense of where some of this data is coming from. So under complaints and violations, we have a metric which is number of complaints made to the BHA about behavioral health services. Probably a bit self-explanatory, but this is data that the BHA receives and is providing back to the public through this metric. Another example is under the mental health category, number of people who receive publicly funded community mental health services per 1,000 people. This is actually leveraging a very interesting data source called APCD. This is the All Payers Claims Database, and it is a robust data set that is actually beyond what the BHA is able to collect. It is data on private and publicly paid claims data. Did that answer your question?
I guess I should have been a little bit, it does, but my concern is more with the child and youth data, like who is reporting that data and how are you guys receiving that on the children and youth side?
Great question. So for this metric specifically, the data comes from hospitals directly. So we're focused for that metric. I would encourage you to look at the documentation there because I don't want to speak out of turn, but I believe it is exclusively hospital provided data that we use for that metric. Other questions while we are paused here? All right, I will move on. So as you can see, there are a couple of other metrics listed here. I won't get into those details for the sake of time, but I'm happy to revisit it if we have time towards the end. Next slide, please. All right, so now for your recommendations. First of all, thank you so much for being so thoughtful and reflecting on what we were able to produce on July 1st and giving us a clear pathway to follow in the months to come. So I wanted to reflect on ways that we believe from our perspective we've achieved some of these recommendations, but I'd love to hear from you all if you don't agree, because we want to make sure we're aligned on this. So first, collect more qualitative data to evaluate service availability, access quality, and impact on quality of life. As you could see in the previous slide, our metrics are mainly quantitatively focused. We wanted to make sure that we were unlocking the data that BHA collects in our first year, and that is mostly quantitative data. So that was our initial focus, but we do agree that this is really important. And for this reason, we've linked to available qualitative data sets and reports in the references section on the main Performance Hub webpage. So I'd encourage folks to take a look at that. But I will acknowledge that that's not where we're intending to stop. We do feel like this is an important area for expansion on the side of data collection, which I'll get into in the next slide. So next item, improve metrics by adding data on demographic diversity gaps, quality of care, quality of life, and access to care. We have prioritized segmentation of data by demographics. As you can see, we have some key demographics in some of these reports, but I will clarify that I think we can go deeper with more enriched data. This takes time. When you improve data collection methods, which we've been doing over the past few years, it takes time for that that better data to be collected. So I will acknowledge that we aren't with this as well intending to stop with some of the demographics that we have. We're looking to expand that as well. Next, provide ADA accessible accommodations. And I won't read all of these just for the sake of time. I'm realizing it's taking a while to talk through all of them. We were very privileged to have some users with lived experience with visual impairment testing and providing feedback on usability before our go live launch. So they used JAWS readers and gave us very specific feedback to improve the usability of the website. That said, one thing that I am realizing as I'm speaking right now, we haven't retested that. And I think that might be something worth making sure we are retesting and on some regular cadence actively engaging these users again. I selfishly just want to work with those folks again because they were lovely and very helpful. Moving on to the next item, improve tool access for to ensure that it's mobile and desktop compatible. The website is both mobile and desktop compatible, and the dashboards should be usable on mobile as well. Next item is to create a guide to help users navigate and understand the data. There are resources available on that first page, and with each visualization to help understand in plain language what it is that we're trying to show with some of these visualizations. So it's also a recommendation that came from our friends with lived experience with visual impairment. They said these dashboards are, I imagine that these dashboards are useful, but plain language, especially for folks who aren't able to see these dashboards, is invaluable. So we have that as well. Moving on to the next slide. So there are some recommendations that we would agree that we haven't explicitly achieved yet, and I want to call those out. So expand data collection for underserved, incarcerated, and repeat service users who face barriers to equitable care. This is something we're actively working on, but as you saw with the metrics, this is not something that's incorporated into Performance Hub, but it is something that we meet fairly often to talk about. Next, incorporate qualitative tools. This is something I mentioned at the top of this recommendation section. It's absolutely something that we want to incorporate, but again, prioritized what we had available to start with, which was quantitative data. This final item, I do want to apologize. I feel like this is probably the easiest thing for us to achieve, which is coming back and speaking with all of you, providing a one-pager on our progress. We look forward to doing that moving forward. Next slide, please. So what is upcoming?
You got someone in the chat. Do you want to pause real quick and let Robert go back before you go forward?
Yeah, that would be great.
Dr. Rob?
Yeah, I have a question. So when you're collecting the qualitative data, like I like that you're getting more than one data, getting data from different sources, because I always hated that the DACODS was the main source of, data that was being collected by the BHA. When you're going to collect qualitative data, have you thought about how are you going to collect that data? Is it going to be through pamphlet or is it going to be through personal interviews? If it is through personal interviews, how will you recruit? How will you go out and hit every community? Same thing with the offender population. We know that the data is better than nothing, but when you give somebody a paper that has a Likert scale on it and it says, I agree, disagree, somewhat agree, we just fly through those. I do. I fly through those even when it's important, it's hard to. So will you be doing interviews and collecting data, qualitative data? If you are, how do you know what communities you're going to reach? And then this is just a future question. We're going to look and I think we're going to see a lot of bigger gaps in services for 2025 with the, not getting political, but with the new administration coming in. We're going to see more gaps in those services of that underserved population. So we're also probably going to have negative report card compared to 2024. Have you taken that into consideration when you're collecting data, or is it just, it doesn't matter, that doesn't matter?
Thank you for that question. And I am happy to respond, but I also want to invite some of my colleagues at the BHA to jump in to support the answer to this question. So to begin, as I mentioned, we were focused on quantitative data. In designing how we want to approach collection of qualitative data, I do believe we're at the very initial stages. So I think what you've just shared is really helpful insight that resonates, but we don't have a plan yet. So there isn't a plan to share yet, but I think this is a really good reminder for our team that once we have a plan prepared before we even begin data collection, to bring it back to this group and other experts for vetting to make sure that we're considering these kinds of important items. Ashley, other folks from the TDA division, is there anything I missed there?
No, I think that pretty well covers it. Yes, something definitely to think about. Not quite there yet. So, yeah. Thanks, Rhea.
Yeah, I just want to say, I just say that because, I've been on the other side of it where somebody's like, when you're not in a good place and somebody's like, here's a Snickers if you could get, if you could fill out this survey. And, I think it's well intended, but also not always the best process.
Totally. I started my career in qualitative data analysis, so a lot of what you said really resonated, especially the lack of utility of Likert style surveys. Definitely. Any other questions? See, there might be a couple of questions in the chat. You want to go to voice on this? Or I can repeat the question. Yeah, go ahead. Sorry.
Okay. I was just wondering if there's data on the out-of-state placement as well as facility safety that's going on with children and youth.
It's a good question. To my knowledge, the data on children or I don't have a whole lot of knowledge on the data available from children and youth, and I'm happy to come back with more information. But to my knowledge, that's not something that's available to Performance Hub at this time. That doesn't mean that BHA or CDHS or another entity doesn't collect that data. It might be the case that it is collected and I just don't know about it. But good reminder for us to potentially hunt that down.
The only reason I bring that up is because of the consent decree when it comes to the treatment and of our children and youth and everything like that. Like, because it's under a consent decree, it would be nice to see where the state is and where it was and where it's at now. That would be a lot more helpful for everybody. Thank you. Jamie has her hand up.
Yeah, I really appreciate you bringing that up, Tasha, because I don't think there's consistent data that is being tracked across the state departments. And I know, for example, counties we manually track our own out-of-state placement data, but those are only kids that are coming through the child welfare system. And that does not always match what the state is tracking. So if we can all come together across all of the entities and get an accurate representation of what that out-of-state number is, I think that would be great.
Very helpful feedback, and we can commit to starting to look into this.
This is Renee. I can't find my raise my hand thing. Sorry. I am curious as to, you said you had individuals that had some sight impairments that were helping to test this. I personally am blind and I do use JAWS, but I'm just curious at who was it that did it? Was it somebody you happened to see, or did you really go to organizations that would be able to give you great feedback? That's what I'm wondering.
That's a really great question. We had a user researcher who was on our team at the time who recruited these individuals specifically from a community that they were familiar with. I'm not specifically, I don't remember specifically what organization they were associated with, but I'm happy to get back to you with that information.
Okay, just curious.
Other questions while we're paused here? All right, so I will talk briefly about what's upcoming. So we have a couple of metrics, specifically 3 metrics on opioid treatment program data that we collect at the state that we're really excited to make available. Before making these available, we want to do extensive stakeholder review, which includes potentially this group if there are any folks who are interested in reviewing that before and providing feedback before we publish. Next, we are doing metric research on MOUD access. This is medications for opioid use disorder, utilizing a new data source, the PDMP, which is the Prescription Drug Management Program. Next, we're diving into behavioral health safety net access metric research and analysis. And finally, we've been working on this for over a year, developing our community engagement plan for Performance Hub specifically, and are eager to reimagine this and expand this. So that is something that is ongoing. Next slide.
Okay, do you want to just do a time check? We do have about
Yep.
2 or 3 minutes until we got to get to public comment. So,
okay. This is the last slide. So this is
Perfect.
a request for support from this group. If anyone is willing to spend some of their time to review the metrics that we have slated for publication next. I recognize that this slide says for feedback in March. Early April is fine. Please feel free to get in contact with us. Lauren just dropped our email in the chat about this or anything else related to Performance Hub. This email is the way to get in contact with us. Thank you so much.
Thank you so much for your presentation. And if council has access, make sure that you go ahead and review that on your own time, jot down questions, grab the email if you need help accessing that or getting help with that, getting that information to the right people. Ask Tasha or myself. We can help you. I'm really interested in that OUD part, especially when it comes to transitioning folks coming out of incarceration. We have some bumps in the road there, so I really would like to give some input there. So if you need me, ask, or I can make myself available. All right, we're gonna move forward. Public comment. And for public comment, you can raise your hand and we can call on you.
Megan Lovelace has their hand up and I've asked them to unmute.
Thank you so much, everyone. Hello, my name is Megan Lovelace, and thank you for this great presentation for the Performance Hub. My question is, so I serve as co-chair of BHAAC, so that's the Planning and Advisory Council, and I love that you all have this public-facing data set, and we talk about data so much, just like you all do. I wanted to follow up on Jamie's question around kind of like shared data. We know sometimes we see some gaps in data too over in our world at BHAAC and kind of specifically around that youth piece as well. So I do wonder if there's a way to aggregate that data in one spot, like the Performance Hub, because it's awesome. What if we have like the whole of those data sets available to us? Because we know that we could all use it if it's in one spot, and it's really hard to dig and dig and dig for it, especially with some of that children and youth stuff. We do know it doesn't all live in BHA and that this is the BHA Performance Hub, but I wonder if it's possible to maybe at least link to some of those data sets. And then with the children and youth stuff, you know, Jamie, you talked about some of it's in child welfare, that's protected, but is there a way for us to see sort of the trajectory of where these dollars are going and how they're getting there in a way that helps us all better inform our decision-making processes? So I know it's a big question. Maybe it doesn't have an answer, but it would just be really cool to see the data in one spot. Thank you so much for taking the time for my question.
Thanks, Megan. Appreciate it.
I'm not sure what the structure is for public comment. Am I able to respond? Okay, great. Thank you so much for the question. To respond briefly to a part that feels very easy for us to do, we do already link to some resources from other agencies and external parties in the Performance Hub, but we don't have everything. So Megan, if you're okay with it, I'd love to reach out to you and this is open to everyone, if you have suggestions for resources that we should be linking out from Performance Hub, that is a very easy thing for us to do. So we'd love to start there. In terms of getting additional data into Performance Hub, that takes a little bit longer, but it's definitely the goal to start combining some of these data sources.
Right, Caitlin in the chat, I hear that. Maybe aggregating the data across all the mental health related agencies like BHA, OFCMH, HICPUF. Wouldn't it be neat to see, especially when we look at the strategy of the BHA, and especially with the commissioners laid out, as all of those are supposed to be able to, the framework to hold it up. It would be neat to see all of those cross points across those, and money, right? Let's ask where the funding's coming from, specifically even with HICPUF. How's that working? And that's going to be interesting as we go through the pending cuts that are coming through to those, right? It'll be even more valuable because we know it's coming, right? That's public knowledge, it's coming.
And I will say that the first metric on the mental health and the first two metrics on the mental health webpage are both BHA and HICPUF data. So we're doing a little bit of that, not enough yet, but a little bit.
Okay. Thank you so much. Do you have Julissa?
Yes.
Okay. Go ahead, you have the floor.
Yes, I would love to see your plan when it comes to objectives, outcomes, when it comes to BIPOC communities, and when you travel to rural areas. I would like to know how many Spanish sessions are you planning to conduct, especially among agriculture workers with their families, ranchers, we know that in many of those rural areas, my community exists, and due to the political climate, right now we're struggling very much, and we're starting to see an increase of suicide among our youth. So we'll love to hear a little bit more about that.
Thank you so much, Julissa. Megan, what are the plans for Spanish speaking, or when we're doing the community engagement?
Yes.
We have 1 minute.
Okay. Julissa, thank you for continuing to flag that for us. So incredibly important. And I will tell you, I answered it in the chat, but I know this is not a good enough situation or answer for you, or for the people of Colorado, but we currently do have Spanish-speaking interpreters that come to all of our engagement sessions. It is a dream and a goal of mine to make it happen to where we're able to have community engagement that is in Spanish, not just with interpreters. So that is absolutely on our radar. It is absolutely a goal and something that we're working on. And I appreciate you, Julissa, for continuing to bring that up and continuing to have these really important discussions with us.
Thank you so much, Megan. All right, we are at time. Tasha?
Is there by any chance that we can make sure that the publications and the reports and everything, when it for child welfare, mental health, children, youth mental health, that there's updated reports? Because on the website, the last website or the last report I think was done in 2023, 2020, something like that. There is not an updated report. So I just want to point that out, and that's across the board.
Noted. Thank you, Tasha. All right. And with that, I will close out and adjourn our meeting. Thanks for joining us today.
Thank you all. Loved having you here. Thanks for joining.
Thanks, everybody. Yeah, have a great rest of your week. We'll talk to you soon. Bye-bye.
Thank you.
Thank you. I appreciate